anybody here, you've got to remember that your therapist is with you for 1 hour a week. That's it. 1 hour a week. You are the person that is responsible for living your life and for actually doing something with what it is that we share with you. You have to live all the other hours of your week. There are times when people come to therapy and they expect that just by coming to therapy and talking to a therapist, things are going to get better. That's not how it works. Rarely it does, but very rarely it doesn't, because your therapist is not actually going to create any change in your life. Your therapist is going to help you find the changes and help you build the skills necessary to implement those changes. Sometimes that's through direct advice. Sometimes people just need to be listened to. I think it's important to take an active role in your therapy and tell your therapist what you would find helpful. Do you want them to give direct advice? Do you need them to sit back and listen? Or do you want them to use what they know about how therapy works to sort of take the reins on that? It is common for people to find therapists that just don't fit and that aren't helpful and that don't do a good job relative to whatever the person's goals are. That certainly happens. However, I generally say that if a person has gone to multiple different therapists with multiple different styles and they still find that their goals are not being met, it's time to do some self-reflection on those expectations, because we are not responsible for your life. We are responsible for using our expertise and our time with you to help you implement the change that you want. So it's not a super black and white thing. It's very much a complex mishmash of expectation, therapist expertise, and hitting the mark, and you doing the work outside of therapy, because just showing up to sessions is generally not good enough to implement the change that people want in their lives.